obesity is a very complex problem. It's something that we view as very simple, that people are eating too much and doing too little, and therefore the solution is equally simple. You should just eat less and move more. But actually it's a far more complex problem than that. And we have to really look at the sort of the environments that we live in, which actually make the healthy choice the abnormal choice. And unhealthy behavior is the norm in our current obesogenic environment. And an obesogenic environment is one that is promoting weight gain.
I would suggest that the mental health issues are in many ways foundational when it comes to the issue of understanding obesity, and then the issue of supporting individuals in making changes to address their obesity. And I say that mindful of I think of the fact that the mental health issues are either easy to dismiss, and they get dismissed either as just not being important at all. There is a real tendency within the area of obesity to simplify things so that the causes are simple. You just eat too much and don't move enough, and the solutions are equally simple: to eat less and move more. So given that, the lived experience of obesity is easy to just downplay. When I talk about, as a psychologist, the mental health aspects of obesity, I'm really talking about the mental health aspects of living with obesity, and being obese, what does that mean if you have trouble navigating a bus because getting into fixed seats is challenging, when people look at you when you walk into a store. The distress that you experience in those kinds of situations isn't because there's a mental health problem that pre-existed that you may have been vulnerable to. It's the actual experience of living with obesity in this world. I think that it's very easy, for a number of reasons, as I've just said, to downplay the mental health problems. In fact, when we look at how do people make changes to improve their lifestyle, then they need to make changes in a way in which that lived experience is really understood. Why is it that people are engaged in certain lifestyles? What drives those behaviors, and what can we do to support change? And I think that when you talk about the mental health issues, and you talk about the role in both the development and the resolution of any of the problems associated with obesity, I think it's important, because hand in glove with those mental health issues are the relationships that people have with others that are trying to support them. And that's where healthcare providers come in, because they can become extremely important for supporting individuals and moving forward. But I don't think healthcare providers know that.
Through this project, we heard of the struggles of individuals living with obesity in a system that really doesn't help them to address their weight effectively. And so we really wanted to give voice to those individuals, but also to the individuals who provide the support that they're looking for.
Everyone just watched me stuff myself in this chair like a sausage. I hate when people look at me like that. I know what they're thinking. Look how fat and lazy she is.
The reason for doing this study really came from my experience as a clinical dietitian in the UK, where I really noticed that we just do not know what we should be doing in order to more successfully manage obesity. So it really did come from that kind of understanding that we're not equipped as healthcare professionals necessarily to offer the best help to people who have a weight issue, and that really is something that we should be addressing more effectively.
I know my obese patients need support and follow-up for their weight loss, but we're overstretched as it is. We just really don't have the time or the resources to effectively offer specific obesity management care.
The study that we did is what we call a multi-level study. That is, it's looking at the issue from multiple perspectives. So from the individual living with obesity, from their perspective, from the healthcare provider's perspective, and then from the policymaker's perspective. So as the problem is multi-level, so the solutions have to be as well.
The type of qualitative methodology that we used, we wanted to focus on a critical lens that was able to understand the everyday, taken for granted practices of people living with obesity, as well as the practices of healthcare professionals. The choice of the methodology was based on a lot of our literature that we had reviewed, and we knew that there was a lot of stereotypes and biases about people living with obesity, and we wanted to further question that and examine all of the negativity, because there was a lot of blame and shame, which really came out in our study. We more specifically wanted to understand how the experiences of obese clients were a part of the interactions that they had with healthcare professionals, and also the healthcare professionals, the experiences that they had. We wanted to know how that played into the interactions that they had with obese clients also.
Many previous studies have actually looked at individual groups, so they've either interviewed people with a weight issue or they've interviewed healthcare providers. What we really wanted to do with this project is actually, again, convey that complexity by looking at 3 stakeholder groups and look between the 3 groups as well. So we're actually comparing and contrasting what the 3 different groups were saying. So we wanted to interview people who have a weight issue. We wanted to interview the healthcare providers that they're likely to encounter in the healthcare system. So that's the dietitians, nurses, mainly sort of practice nurses, and physicians as well. So we really wanted to sort of, again, represent the type of experience that people are likely to have. And the policymakers provide that additional lens around how structurally we address obesity in the healthcare system. And essentially what we're looking for there is the sort of the barriers around providing support for individuals. The healthcare system, as it's currently structured, does not do a good job at supporting people who have a chronic health condition. The healthcare system is set up to deal with one problem at one appointment, rather than actually recognizing that often, particularly in terms of chronic disease, that people may have multiple problems.
If we look at Foucault, who is a post-structuralist theorist, and that was drawn upon for our methodology, what he says is it's really easy to identify those conflicts and the tensions and some of those moments of being uncomfortable. So I think most of us are able to do that in a lot of interactions. So whether we go to see the doctor or the nurse or the dietitian, and whether you agree or disagree, those moments are pretty easy to identify. What's more difficult from his perspective is that how do you understand why those conflicts are happening? So how do you begin to dig below the surface? So with this methodology that we used, discourse analysis, it's picking apart those moments and those experiences. So you really need to sit down with the client, with the participants in our research, and just listen to their stories. So we had open-ended interviews, which lasted about an hour or more, and it gave them an opportunity to talk about what was important to them. So from the perspective of clients living with obesity, just to have that moment or that hour talking to our researchers, they really gave us a lot of very personal information, and for the most part, I think they were very appreciative of someone listening to their story and to be able to express that. Also for the healthcare professionals, the nurses, dietitians, and doctors, they, again, just had that one-on-one time to be able to express their concerns and their feelings and their experiences too. When we focus on what people are saying, and a part of our research is not to look for one truth. We don't want to get to one answer. With this methodology, we look at a variety of experiences, so being able to look at differences between people. And that really opens us up to be able to, again, look below what we think we know and to see maybe what are some hidden understandings that could be surprising or different. And those differences are what can help us inform our practice and maybe change things along the way as we go forward.
As you can imagine, with interviews from over 40 individuals, so that's a range of individuals, of people living with obesity, healthcare providers and policymakers, we generated a huge amount of data. But what was really interesting is that there were several themes that actually were seen across all three groups. So these are themes that we can consider to be fairly powerful, because each group mentioned them, albeit the context might have been different for the way that it was presented by each group. The three key themes really came out. The first theme was weight bias and stigma, and that speaks to the feelings that people with a weight issue had when they went to see a healthcare provider, that they felt judged, they felt in some cases disrespected.
Weren't you going to take my blood pressure?
Oh, yes. Almost forgot.
I wonder if you really forgot, or if you just didn't want to get close and have to touch me. What was that look on his face?
And healthcare providers also mentioned that they felt that other healthcare providers expressed those kind of views towards individuals living with obesity, although they didn't actually admit to holding them themselves. Of course, we know from research studies that many individuals, healthcare providers and members of the general public do hold views around weight bias and stigma. So we do expect that we would see that. Policymakers also expressed that they had seen this play out in the healthcare system, and particularly around how resources are allocated within the healthcare system. The second theme we found was around blame and personal responsibility, and that really speaks to how we view obesity as a problem that's under the control of the individual. So all somebody needs to do is eat less and move more, and if they are unsuccessful at that, then there's something wrong with them, rather than recognizing that approach maybe isn't helpful, and actually doesn't recognize the complexity of obesity and the fact that there are many, many things in our environment that actually makes the healthy choice the abnormal behavior at the moment, and the healthy and unhealthy behavior is the norm.
I think it's been drilled into our brains for so long that the reason people are obese is because it's something they could have controlled but didn't.
And people don't think that they should help you. They think that it's your problem. But people who are severely obese have other issues. It's not just a simple matter of cutting back on carbs.
Blame and personal responsibility really kind of, again, highlights the long way we have to go before we recognize obesity as a complex issue, requiring a much more complex approach to its management. The third theme that came out was around the tension that is often found in the healthcare system around whether to address obesity by managing it once it's already developed, or whether to try and prevent obesity from developing. And so the sort of like what we call the upstream approach around creating environments that support the healthy behavior as the norm, or whether to actually address obesity once it's already developed. We learned from individuals living with obesity that the relationship that they form with their healthcare provider is absolutely key to their success at losing weight. And so really, if that environment isn't supportive, then there's a really missed opportunity to support an individual with sustained weight loss. And so we really want to look at how we can better equip healthcare providers to provide the kind of relationship that is supportive to the individual, that is mutually respectful, that develops the trust that is essential for better managing this problem.
What's wrong here? I'm doing everything I was taught, and yet either it isn't working or it's not enough. People need to understand that diet and exercise will work if they just stick with it. But I don't have the time to develop the level of trust with my patients where they'll just take my word for it.
It came through loud and clear with all of our participants that they wanted to talk about their weight, and when it wasn't, that was very upsetting to them. They felt dismissed, demeaned, disrespected, because to them it's so obvious that this should be a part of their care.
I wonder if he'll bring up my weight this time. Well, if he doesn't, neither will I. Maybe he doesn't want to offend me. Well, guess what, Doc? I already know I have a weight problem. So you're not helping either one of us by sparing my feelings.
So it really comes down to the relationship. That came out loud and clear in our research, to be able to look at that. And sort of bottom line, to be able to respect the stories of the clients.
Shouldn't healthcare providers already know this stuff, that the relationship is important, understanding the root causes of obesity, understanding just some of the challenges that people face that are really normal challenges? As it turns out, the answer to that question is actually no. We're woefully inadequate when it comes to our understanding of what is it that our role is in supporting individuals to achieve healthy weights. And this is an area that I have a lot of interest in, because it really defines kind of one of my professional contributions to obesity, which is how do you help healthcare providers learn how to have relationships with individuals living with obesity that are more helpful rather than less helpful. And as it turns out, most healthcare providers are trained in the following model of establishing a professional relationship, and that is the expert clinician with the uninformed help seeker. And so as a result of that, we know what to do, and we're going to tell you what to do, and unless there's something wrong with you, you're going to follow what we tell you. So that describes the fundamental relationship that most healthcare providers enter into. So in fact, many healthcare providers are very stressed, personally stressed, when they kind of have to give that role up, and they're no longer in charge, or it's no longer their job to tell the patient what to do, but their job to understand the individual. And I think that if you talk to individuals living with obesity, they've known for a long time that healthcare providers are inadequate, and they just haven't felt empowered as to how they can, kind of participate in that process.
Language is very, very important, yes. And again, this methodology, feminist post-structuralism, it makes you stop and think, what does a word mean? And again, that taken for granted, what words do we mean? Obese, fat, overweight, and I think those terms have changed over the years. So it really is contextual. There has been some research done on that have asked clients who are living with obesity, what makes you comfortable, what doesn't make you comfortable, and sort of the bottom line would be addressing the situation, which seems to be very hard, not just for healthcare professionals, but I think for a lot of people in society. It is uncomfortable for people to talk about obesity and being overweight. And and so what is the language? And we're not sure exactly what word is the best word to use, but as long as it's done in a respectful way, an acknowledging way. So I think we still need to explore that a little bit. The healthcare providers, they recognized all of these things. They know these stereotypes exist, and that's what creates some of that discomfort. And their ability, or maybe their inability, to be able to broach the sensitive topic of obesity. Also for obese clients, how are they able to overcome that? And some of them were able to address these difficulties with their healthcare providers, and some of them weren't able to do that.
It's his job. I should just tell him that my issues with food are getting worse.
So to have that open communication would definitely be a part of it. And to be able to have that courage and that strength to challenge those uncomfortable moments. Those spaces, those pauses, those silences, those anxieties from both sides of the story. And we heard it on both sides.
In primary care, so in family medicine, so if you talk about family doctors or nurse practitioners working in a family health center, they don't talk about obesity. It's just silent. It's just they avoid the issue because they don't feel comfortable talking about it, because they can't be the expert, because they've tried being the expert and people haven't benefited from those kinds of directive advice. As a matter of fact, they've found it kind of judgmental and insensitive, so it actually harms the relationship. What's really nice about it is that when you actually ask these healthcare providers, do you know that you're avoiding raising the issue of obesity? They say yes. And if you say, why are you avoiding raising the issue of obesity? They say, because if we ask these questions, we're going to, quote unquote, open a can of worms. That's literally how they provide it. In other words, their perception of what the individual is going to say is going to overwhelm them.
So, anything else?
There was a time when I was losing a lot of weight, and then I had a hysterectomy. And 6 weeks later, my mother died very suddenly. I lost 10 months of my life just like that. Emotionally, I was a wreck. I went to the doctor and he put me on antidepressants. But all they did was make me sleep all day, so I threw them away.
And what's even better is if you say, well, are you interested in learning how to open that can of worms in a way that can be helpful? A significant proportion of healthcare providers are actually interested in that. Fortunately, there's a lot of interest in helping healthcare providers develop sensitivities and develop strategies for improving the relationships. In a professional arena, we call it motivational interviewing, which is really just a label that we use to describe relational strategies. How do you establish a relationship? So rather than the expert clinician with the uninformed help seeker, it's two people each who have competencies who come together to try to work to solve a problem.
So the first thing we need to do is improve the relationship that an individual has with their healthcare provider. And so that's something that will involve training in healthcare, in the relationship that a healthcare provider has with an individual. So we need to better equip healthcare providers to provide a supportive relationship that isn't judgmental.
Addressing obesity, we don't talk about that in our undergraduate programs specifically or so much. So I do think that some work is needed in our education programs, but to build on that too. So I think the tools are there.
So the healthcare system as it currently is does not allow us to provide ongoing support to individuals. It's very much a sort of a short consultation that doesn't facilitate, the longer conversations that we need for managing obesity. So we either need to develop ways of providing the support that people need in a sort of a brief intervention, and we can do that certainly. Or we need better ways of enabling people to access the services that they need beyond the physician's encounter. So providing better access to, for example, dietitians or practice nurses who are able to give better support beyond the encounter with the physician. And for the policymakers, we also have recommendations that are around, again, the allocation of resources to weight management. We need to give people better options for weight management and provide better support. Alberta, for example, actually reimburses physicians for dealing with complex problems, and obesity is counted as one of those problems. So, providing more funding to physicians who are providing better care to their to individuals living with obesity. So we really need to recognise that obesity is costing the healthcare system a lot of money already. People with a weight issue do tend to see their doctor more often, and they do tend to have multiple problems. So it's not usually just a weight issue that a person presents with, but complex chronic disease as well. So this issue is costing us dear, and we need to better manage it. So it will cost money to address the problem, but I think we have to recognise that we have to connect the dots. That it's costing more money already. We need to address it. How can we do that in a way that actually is going to improve the management and thereby improve outcomes, which in the long run will save money. So the data we have was collected in Nova Scotia, but it really does resonate, I think, across the world. This is a global issue. And while the healthcare system in Nova Scotia may be fairly specific to this area, really this is something that certainly applies across North America and elsewhere as well.